The London Bridge Sports Medicine Podcast. Medical news, health, fitness with Dr. Ajai Seth.
Hi there, today we talk to Diedre, who's a pelvic health expert, about the topic of coccydynia. This is a really common cause for lower back pain, and we discuss how it presents and what we can do to treat it. If you feel any of the issues discussed are relevant to you, please feel free to get in touch to see how we can help. Hope you enjoy listening. Welcome back, Diedre.
Hello, hi again. Nice to be here again.
Thanks for joining us. It's been an interesting time in the clinic, and we've seen lots of patients with pelvic health issues. And I thought it would be a good time to chat about some hot topics to do with pelvic floor.
Good, I'm in.
Right. So today I want to have a chat about pelvic girdle pain.
Okay. Yes.
So this is a diagnosis I'm not sure many people will be familiar with, even patients, let alone doctors.
Yeah.
So tell us, what is pelvic girdle pain?
So pelvic girdle pain is a condition that we predominantly see in pregnancy, and it's really an umbrella term for pain that people have in and around the pelvis during pregnancy.
Yeah.
It used to predominantly be called SPD, which stood for symphysis pubic dysfunction.
Yeah.
But we know that actually the pain can be the front, at the back of the pelvis, in kind of underneath kind of the genital area,
right, into
the buttocks, down the back of the leg. So
sounds horrific.
It can be. It can be. So yeah, it's a pain condition that's linked normally with pregnancy, but sometimes even without.
Okay. So pregnancy, by all standards of evolution, doesn't seem a very comfortable experience.
No.
So women end up suffering with lots of different conditions. Mainly, a lot of it focused around the pelvis, but back pain and all sorts. Yeah. Why does that happen? Is it literally the size of the baby growing inside the pelvis, or what are the why does it happen in the first place?
Yeah, so there's different theories, different things that people think might cause issues. The biggest ones that they tend to see will be the risk factors for people developing something like pelvic girdle pain will be previous back pain that they've had in the past,
right,
and if people smoke.
Oh, really?
So smoking can be one, just because again pain factors and things like that can be heightened.
Yeah.
So those things tend to be the biggest one. They haven't shown things like baby size or previous pregnancies to be risk factors or kind of reasons why people might get this. So it tends to be kind of previous injury, the biggest thing.
So you were saying about the risk factors, so smoking was one. I was mentioning baby size, and I mean, most people that I mentioned would assume, the baby's growing and it's pushing the pelvis, and they would thought actually that's the cause of the pain. Yeah. So is it more to do with how sensitive you are to pain?
That's definitely a theory that we will see.
Yeah.
So if you've had a previous condition, previous back pain, is that area already a little bit sensitive?
Yeah.
Probably, and is that why you're more likely to get these types of pains?
Yeah.
That's something that we would say. Okay. The other theories that people will kind of suggest is that hormonal factors. So as we get pregnant and kind of the hormonal changes take place, you're more likely to have less support from a lot of your kind of connective tissue structures, so your ligament tissues, your muscular structures. So there's a theory that because you've got less support around the pelvis, that there's more likely to be bigger kind of load forces going through the joints, and that can make a difference. And then posture is another kind of potential theory that people will kind of suggest.
So it sounds like there's some of these things you can work on as a pregnant lady, and some are just hormonal and part of biology.
Exactly.
And that needs to happen, obviously, because the pelvis does change shape as women become more pregnant.
And needs to.
and needs to, obviously, for obvious reasons, for the baby to come out. So when does it normally happen within pregnancy? What sort of period? Is it at the beginning, middle, towards the end, or?
Really variable across patients. So some patients we'll see kind of in really early stages. So they might come in even at kind of 8-10 weeks pregnant, which
So that doesn't make sense to me.
Exactly.
You haven't really
got any bump.
You haven't got a bump. Then the baby's still very small. It's still almost sort of fetus stage, isn't it?
Yeah,
so
exactly.
So that does show that actually there is a sensitization or a hormonal element to it.
Yeah, definitely.
Okay.
And that doesn't mean that they can't still change their pain even if they come in at that early stage. Because we know that, again, they might have some kind of muscle imbalance or muscle weakness around the pelvis. They might have, again, a bit of like postural, not changes, but maybe just posture-wise previously, their kind of posture needs a bit of kind of addressing. So there's definitely things that they can do even in kind of any stage really of the pregnancy. And we'll see people right up until some of them come in even a week before and their pain's only just started. There's huge variation of when.
It's a huge variation, and that's important to know. So if you're in the earlier stages of pregnancy and you're having pain in and around the pelvis, again, it's a very alarming symptom. Because obviously you're worried about the health of the baby, and so the first steps I imagine would be to go be checked out by an obstetrician or someone who deals with pregnancy, or
well, not necessarily. So normally what they'll do is if they're having any kind of tends to be like if there's sharp pain, if there's bleeding, that those things definitely you want to get checked either by like the fetal medicine unit or kind of touch base with kind of your midwife, and they'll kind of give you the best advice as to come in, who will be seeing you at that point. A lot of the time they're able to differentiate the fact that it is muscular or kind of joint pain. So they'll kind of say it's a bit sore whenever I turn in bed, or it's a little bit sore whenever I kind of sit down or stand for too long. So if you're getting those types of pains, then the first thing would be to kind of come and see a physio.
Okay. So that's interesting. And so it doesn't all need to be alarming. And actually, some pains which feel a bit like muscular or achy, sort of in and around the pelvis, physio might be a good option. But if you're not sure, just seek help and speak with a midwife. I think is the first good step.
If you're not sure, if you can't differentiate that it's like kind of muscular jointy pain, they tend to be those types of pains. They tend to have like triggers, so something that they can kind of link that it's sore when I do this, it's sore when I do that. Whereas the kind of more alarming pains are ones that are just kind of random or just happening for no particular reason. But if you're not sure, definitely kind of touch base with your midwife as the first.
And at the beginning you mentioned quite a few locations of the different types of pain. What is the most common? So when I think of pelvic girdle pain, it's mainly around the front and the pubic symphysis. Is that true, or can it be anywhere in and around the pelvis?
It can be anywhere in and around the pelvis. So we're thinking the top of the hip bones, that kind of what we call an iliac crest, anywhere from there down to the bottom of the buttock muscles, that whole region, and kind of across the front in that region is kind of any of that would be classed as pelvic girdle pain. The ones that we predominantly tend to see, I would say, are lower back, SIJ, and the symphysis pubis, so that kind of pain at the front of the pelvis. So those would be the three areas that we'd say
see the most
anyway.
And so what are the best treatments? So you're suffering with pelvic girdle pain. What are the best therapies normally?
So the best therapies are strengthening work around the pelvis, so looking at some muscle exercises to try and help make sure that we're staying strong in and around that area, especially if we know that there's going to be hormonal changes which are affecting some of the support around that area. They may need some kind of manual therapy, so whether or not that's helping work to help some stretch some of the muscles or release some of the muscles if we know that we're getting a little bit tight through some of those structures.
So you can get quite hands-on within the pelvis.
Absolutely. So we can get hands-on. We do a little bit of kind of, if the joints feel a little bit stiff, we can do a little bit of movement around the joints. We can help with some of the muscles and some strengthening work. And those two kind of have to go a little bit hand in hand. So predominantly it shouldn't just be one or the other. Actually a mixture of those two things I think works really well for a lot of these patients. It used to be that kind of when they were seen previously, especially if they weren't seeing somebody that was specialised in pelvic health, that they would just be given crutches and a belt.
Oh, wow.
and kind of sent on their
Oh,
way
dear.
for the remainder of their pregnancy, which is not so good in their long-term recovery approach. And some women do need that. So some women will need that step, especially if their pain is really severe.
It's severe, okay.
But shouldn't be for everybody. That is the kind of only treatment option that they're given.
Yeah. And does it go after pregnancy? And what sort of steps need to be taken after pregnancy?
For the majority of women, it will. So pretty much once they've had the baby, the pain tends to disappear, especially within that kind of first couple of weeks. So for a majority of women, it'll be straight away.
Yeah.
For kind of a few more, it'll be kind of into those few weeks.
Yeah.
There's about 5% of women who will have pain kind of moving forward long term from that. And if they've not seen a physiotherapist before, then they should definitely consider seeing one after the delivery to try and help.
Fine.
Like
So most women, well, I imagine the vast majority of women would have put up with some form of pain. I mean, it's never going to be pain-free, right, pregnancy. Most of the time, is there some form of issues to do with the pelvis, or?
No, not in every woman. So some women do have...
Certainly not the labour part, anyway.
Not the labour part, that part. You just have to deal with that.
Okay.
But yeah, during the pregnancy, so the statistics are about 20% of women will have PGP, or pelvic girdle pain.
Okay.
So there's quite a lot.
That's lower than I had expected, actually. There
will be some women who won't necessarily have any pain, or might have it kind of very late into the pregnancy. So so I've seen a couple of women who have been, they've had 1 week to go until they deliver, and their pain's just started, so they've come in to be seen.
Okay, fine.
Great for them.
Yeah. They haven't started delivering yet, have they?
No, luckily not. That'll be shoot out. They can have pain. They might have other symptoms in terms of they might have restless legs at night time or kind of things like that. But pelvic pain wise tends to be about 20%.
Okay. So that's brilliant. That's a great overview, great insight into pelvic girdle pain. What would be your top tips for women who think they may be suffering from this?
Top tips would be, you're turning in bed, keep your knees and feet together as you roll. Same for getting in and out of a car. So can try and keep your knees and feet together and swivel.
To stabilise the pelvis.
Yeah, just to keep those kind of joints and areas that are a bit painful from kind of being overstretched or overused.
Okay.
If you're putting on underwear or socks, sit down to do that rather than standing on one leg. And when you're walking, try and take smaller stride lengths. So try not to kind of stride out too much. Those are the kind of top 4 tips. And then obviously, if you're concerned, if you're worried, touch base with your midwife. If you think that it is muscular, see by a physio and kind of get the right treatment for you, because everyone's treatment will be slightly different depending on kind of what they need. Yeah.
Brilliant. Thank you so much. That's been very enlightening, Diedre. Thank you. And we'll definitely have you back soon to discuss more pelvic issues.
I'm in. Good.
Okay. Thank you, Diedre. Take care.
Thank
Bye-bye.
you.
See you later. Thank you for listening to LBSM's Ask the Expert series. We really hope you enjoyed listening. If any of the topics discussed are relevant to you or you want to find out more, please get in touch by phone, email, social media, or visit our website. Thanks again and see you soon.